Heel pain, or as some people refer to it as plantar fasciitis, is probably one of the most common things we see here in the office. Typically what it is a large band of connective tissue or soft tissue in the bottom of the heel, and it becomes irritated by sometimes patients being overweight, sometimes from excessive activity, over-exercising or improper shoes, or sometimes patients with either high arches or flat feet. We see it here in the office, and we initially treat it in a conservative fashion. Conservatively meaning we'll take x-rays in our office. We use a diagnostic ultrasound to sometimes identify the tissues and see if there's any excessive inflammation or tear in the plantar fascia. Then what we will do is address the area with either an oral anti-inflammatory or possibly a cortisone injection if needed to try to reduce the inflammation. I feel that initially the best way to treat it is to deal with the inflammation initially to get the patient comfortable and reduce the pain. Following that, then we'll proceed in trying to address the cause of the problem. If it's a flat foot or it's a foot that has too high an arch, then sometimes we'll address it with a mechanical control, whether it's corrective shoes or corrective functional orthotics, which we can do here in our office. We have all the services here in the office, including night splints and various types of off-the-shelf orthotics to help our patients leave with something immediately to help address the problem and the initial pain. And then once we get the pain under control, again, like I said, we would correct the mechanics of the problem. Our office is also equipped with some high-tech services that are not available in most podiatry offices. We include extracorporeal shockwave therapy, which sounds dramatic, but it's actually a non-painful treatment that addresses the cause of the problem and also heals the problem. So it has a much long-term effect as far as reducing the pain and inflammation. There is also another treatment which we use called autologous platelet concentrate, where we can actually take the patient's own blood and extract out the platelets or the healing factors, and then we can re-inject that back into the damaged tissue, and it stimulates healing. Now, this is being used by a lot of the NFL teams and a lot of the sports medicine specialists throughout the country. So it's something that's very advanced and something available in our office.